older Americans, those of us who may be eligible for Medicare. And we've got to think about what has not happened in the past that will now happen because of the new act. You heard it very clearly, explicated by the first speaker. What AARP has said, and we will continue to say to anybody who will listen to us, that we're here to give our members, that's those of you who wish to join. If you haven't, it's only $16 a year. It's a very good decision for you and your family because of the information. We intend to monitor what's going on. And Congresswoman Christensen, the CBC know that AARP is always on the Hill. You see somebody, you see Ms. Price is out there, you see our folks up on the Hill, our Policy Institute are every day looking and monitoring every piece of this legislation and potential legislation and what's going to happen, and are in contact with our elected officials and policy makers. One of the things that we do know that this is a very personal piece for you. People want to know what the law will mean for them and their families, and you've gotten a good bit of it. We have here, and if you haven't picked up one, I hope we have enough, what we've produced called Healthcare Anew, and it's the new Healthcare Act and how it impacts African Americans. And it places in writing what was explained before, things like Medicare D, the donut hole. If you reach your maximum this year, you should have gotten your check already. There's still some more checks that will be going out. But 3 million people, got it. So we know that we're going to help people navigate. It's great. We have these intelligent, wonderful people we've elected. We've got to help them to make sure that every one of you know what's going on. And that's one of the things we will be doing. So what we would like you to do is take a look at our website, our last slide, that tells you and gives you more information about what AARP is doing for you. We know, and I will be upfront with you, that we need to talk more to you. We need to be in contact more in our African American communities. We've got the tools already set up. We've got right here our Mississippi State Director, Sherry Davis Garner, who is right here. We've got a cadre of AARP volunteers in this state. So we thank you, and AARP says we're not done yet. We're waiting to see what we'll be when we grow up.
Yep. Thank you, Dr. Georges. Our next speaker will be Dr. Warren Jones.
Well, good morning, everyone. Thank you for the opportunity to be here. I had the pleasure of being on this panel 2 years ago, and I thought it was the most nervous I had ever been in my life. I now have to call that experience the second most nervous I've ever been in my life, with today clearly being number one. As this slide will show you, I am the Executive Director of the Mississippi Institute for the Improvement of Geographic Minority Health. And out of that institute, it's a new entity as a part of the University of Mississippi, and we implement a federal grant called the Delta Regional Institute Grant, hence the logo. So I'm not schizophrenic. We really do have two titles. I'm going to talk with you about a state's view. And I need to let you know that I am not an elected state official, I am not an appointed state official, and I am not speaking on behalf of the University of Mississippi Medical Center. However, I have run the state's Medicaid program. I have served as the medical director to the military health system, and I have led the American Academy of Family Physicians. So I can give you a perspective on what's going on in the state that I've chosen to call home, that I hope will impact you as you go back to your states. How many of you are from states other than Mississippi? Please raise your hand. So great. What I'm going to do is I'm going to use some Mississippi data to illustrate what you may be facing in your own states as we talk about this plan and how it impacts you. Next slide, please. So we want to talk openly about the Act. We want to discuss the impact on blacks and the underserved, and we want to explore ways to coordinate activities that I hope will come out of this dialogue, because as you heard Congresswoman Christensen say, the work has just begun. Okay? So next slide. So as background, Mississippi has a state of about 2.9 million people, 2.89, and blacks account for 1 million of that population, or 37%. It's the largest percentage of African Americans in any state in the country. Okay. We're the fourth most rural state in the nation, and we have the largest percentage of our population living in rural areas. Why are these important? Because in your states, a lot of blacks and underserved lived in rural areas, and there are data recently to show that there exists a rural health penalty, where people who live in rural areas have a shorter life expectancy. And so they're all things that will be impacted we need to be aware of. Next slide, please. About 27% of our population lives at or below the federal poverty level. And if you look at this legislation, if you look at this law, it specifically addresses 133% of the federal poverty level. So that adds another 8.3% of our population. So when you look at it in reality, well over a third of our population is impacted by this law to ensure that there is access to care available for them. When you look at our economic situation, over 500,000, almost 600,000 of our state's residents are on food stamps, per the Kaiser Family Foundation. And 18% of our population is uninsured compared to 15% of the U.S. I'm giving you some data not to be just a number wonk, but I'm trying to help put it in perspective. This is the thing that concerns me most, that over 13.5% of our children in this state are uninsured and uncovered. And there are barriers to that that should not exist compared to the United States as a whole. And 1 in 4 Mississippi residents are covered by our Medicaid program. So we've got some challenges, as you have in your state. Next slide. When you look at the income levels in Mississippi compared to the United States, we have a larger percentage of our population under 133%, as I just showed you. Kaiser shows this graphically, and I wanted to just illustrate that. And why is that a problem? It's a problem, next slide, because when you look at how coverage occurs, in many parts of the country, coverage occurs by employer-based plans. In Mississippi, that is not the predominant way for coverage. The predominant method of coverage here is Medicare, Medicaid, and self-coverage or uninsured. So we're facing some challenges here, and the question will be, how do we make sure that folks get the care that they need? Next slide, please. Now, why is this important? It's important because Mississippi has a significant disease burden. We're number 1 of all states, plus the District of Columbia, in cardiovascular disease. I ask the question when I go out and give a talk, how many of you in the room have somebody in your family or a very close friend that has had either a heart attack or a stroke before age 50? And I'm amazed that 2/3 of the hands in the room go up. It is a very real problem, and it's a reason why this law must be made successful. It's a reason why. You can look at data on how African Americans have died at higher rates excuse me, of cardiovascular disease. Claiborne County has the highest rate of cardiovascular disease death for African American males in the entire nation. It's emblematic of the kinds of things that we have to change. Next slide, please. We have a problem with infant mortality while we've improved it. The measure of society, it was said, is how they treat people at either end of the life spectrum, the very young and the very old. If you look at our infant mortality rate, it has improved to 10.6 per 1,000 population, per 1,000 live births. That's improved to that, okay? And the national average is 6.8 per 1,000. Our teen deaths. The best measure, the best predictor of our future is how our young people progress and become empowered to take over the responsibility. We have a 98, we're losing 98 per 100,000 teens compared to 62 for the rest of the state. Many of them are health-related causes. HIV/AIDS, the data goes on. Overweight and obese children. How many of you have or know a fat kid? Why do I say that? Because the data are showing that children who are obese tend to have a higher burden of illness as they grow older. They have a lower self-esteem, and they have a lower performance rate, which means that they are becoming a permanent underclass. Mm-hmm. And in our state, 44% of our kids are obese. Now, the nation shouldn't be proud because 31% of our kids in the country, almost 1 out of every 3 kids in America, is obese. And when we talk about morbid obesity, significantly obese, it gets worse. Next slide, please. And obesity is important.